In this video, you will learn the nursing interventions for furosemide. Before we start, check the description below for free sources to help you become a nurse and pass nursing exams on your first try. Also, stay at the end of the video to complete a 3-question quiz to test what you learned at the end of the video. Let's begin. Beyond assessment, the nurse's responsibility in furosemide administration extends. Implementing nursing interventions is another step necessary to guarantee the drug is taken safely and effectively. The following are important nursing interventions and their rationales when providing care for patients who are receiving furosemide. Furosemide should be administered in accordance with the recommended dosage, method, and timing. This intervention ensures that patients receive the intended therapeutic effects of furosemide and helps maintain fluid balance. Document the patient's daily weights, fluid intake, and output, and look for any indications of fluid excess or dehydration. Remember that furosemide promotes diuresis, and keeping track of fluid balance helps establish the medication's effectiveness and directs changes in dosage and fluid management. Continuously monitor blood pressure to assess the patient's response to furosemide therapy. Monitoring assists in identifying hypotension or other abnormalities that may require dosage modifications or extra interventions because of the diuretic effects of furosemide. Provide thorough patient education on furosemide, covering the drug's use, dosing guidelines, possible adverse effects, and the importance of compliance. Educate patients about the signs and symptoms of electrolyte imbalances and when to seek medical attention. Empowering patients with knowledge promotes their active participation in their own care. Educate patients on dietary modifications, such as following a low-sodium diet, if applicable. The body's fluid balance is mostly regulated by sodium. High sodium intake might worsen conditions that call for the use of diuretics and cause fluid retention. Patients can support a more balanced fluid status, which is consistent with the goal of furosemide medication, by eating a low-sodium diet. Encourage regular exercise and weight management to support fluid balance and overall cardiovascular health. By enhancing circulation and lowering fluid retention, regular exercise can improve fluid balance. Blood flow is improved by exercise, which might facilitate the body's removal of extra fluid. Furosemide with exercise have a synergistic impact that can improve fluid balance and lessen edema or fluid overload symptoms. Regular exercise is recognized to have many cardiovascular advantages, such as heart muscle strengthening, reduced blood pressure, and improved cardiovascular health. Note any side effects or adverse reactions of furosemide, such as allergic reactions, ototoxicity, or severe skin reactions. Prompt identification and reporting of adverse effects enable timely interventions to minimize complications and improve patient outcomes. Communicate and collaborate with other healthcare professionals involved in the patient's care, such as physicians, pharmacists, and dietitians. Coordinated care is ensured by sharing essential information and seeking advice as necessary to improve patient outcomes. Mini quiz. From here, you will answer 3 questions to reinforce your learning. Starting with the first question. What is the purpose of continuously monitor blood pressure to assess the patient's response to furosemide therapy? Pause the video here to write down your answer. The purpose is to identify hypotension or other abnormalities that may require dosage modifications or extra interventions because of the diuretic effects of furosemide. Next question. True or false? The body's fluid balance is mostly regulated by sodium. High sodium intake might worsen conditions that call for the use of diuretics and cause fluid retention. This is true. Last question. Fill in the blank. Furosemide promotes diuresis, and keeping track of fluid balance helps establish the medication's blank and directs changes in dosage and fluid management. The answer is effectiveness. In the next video, you will learn the patient education and teaching for furosemide. If you enjoyed this video, please like and subscribe for more. Thanks for watching.